7-day average has been rising for 20 straight days, but that might not tell the whole story. 12 News' Kent Wainscott is live on Milwaukee's west side tonight. Kent, health officials say testing numbers are a concern.
Yeah, that's the problem. COVID testing numbers are down. It's still quick and easy to get a COVID test if you want one. This pharmacy drive-through where they do testing is an example of that. But health officials say that a lot of people, even those or maybe especially those who are vaccinated, may not be getting tested even if they're experiencing mild symptoms. And they say that can make it more challenging to know exactly who has the virus and where it's spreading. Wisconsin is seeing a bad combination. COVID cases and testing numbers both heading in the wrong direction.
We don't want to see a rise in cases and then a decrease in testing ability that starts to blind us a little bit to what's going on in the state.
Spurred by a surge in the Delta variant, COVID cases have reached their highest level in more than 2 months. But the number of people being tested for COVID has dropped dramatically from more than 10,000 on the final Sunday in April to just over 3,000 statewide on this last Sunday in July.
Without sufficient testing, do we really know how widespread this is?
There may be more cases out there than we realize this year, just because folks with what is perceived as mild disease may not go through the hassle of getting a test.
Is it possible that this is more widespread than we realize?
Sure, that's always been a possibility, especially when testing numbers are low. So it's really important for anyone with any COVID symptoms to go out and get tested.
People who are vaccinated may contract COVID and experience mild symptoms or none at all. But health officials say they can spread the virus, putting anyone who's not vaccinated at more serious risk. The Department of Health Services emphasizes the best way to stop the spread is through vaccination. A spokesperson telling 12 News that while COVID testing is quick and easy, isolating variants like the Delta variant can take longer, adding the more people are tested and diagnosed, the more quickly they can be isolated to prevent spreading the virus to others. Dr. Potoff says that's true even if you don't think the symptoms you're experiencing are COVID.
If you have mild symptoms, your kid, someone you know, it's really important to go get tested for COVID.
Kent, do we have any idea how many breakthrough cases of vaccinated people contracting COVID there are in Wisconsin?
Yeah, Patrick, that's the challenge for health officials, right? Because a lot of those asymptomatic or mild cases may not be showing up in the state data because those people aren't going to get tested. But of the actual numbers that the state has right now, just 1.6% of the total COVID cases are breakthrough cases, people who've been vaccinated, which means that nearly 98.5% of all of the cases are among people who have not had the vaccine.